Welcome to this month's Roundtable Live, Public Health Roundtable Live. Excited to be joined with these guests, my panelists today. I'm Dr. Huntley, and I am the CEO and founder of DrCHHuntley, LLC. We are a consulting firm that supports large nonprofit organizations, mainly BIPOC organizations, or those that are looking to serve BIPOC communities. And we just simply help them with communicating their health information in plain language to communities they serve. I'm also the host of the Public Health Epidemiology Conversations podcast and support entrepreneurs who are also interested in this space of this intersection of public health and entrepreneurship. And I have two fantastic panelists joining me today. We're going to be discussing health equity, developmental disabilities. This is Developmental Disabilities Awareness Month, and we're going to be sharing a bit on that topic. But let's have them first introduce themselves. So we'll start with you, Dr. Gordon. Please introduce yourself.
Hello, I'm Dr. Linda Gordon. I'm a pediatrician, and I am also the CEO of Childverse Inc. We aid with health navigation for caretakers and advocates of children with mental illness through creative media and thought leadership. And our creative media includes children's books. It includes an active website with resources for parents and a blog of testimonials from a variety of subject matter experts. And thought leadership, we're looking to grow and develop and working with organizations that advocate for these children.
Thank you for that wonderful introduction. And Ericka Horne, introduce yourself.
Hello, everyone. I am Ericka Horne. I am the CEO and founder of Akiri Consulting, LLC, where we work with faith-based organizations, churches, and nonprofit organizations to help bring about and bring to life their health-related programming needs. So whether it's at a health fair or a health resource fair or program planning for a long-term health event that they have going on, we are here to support them in all those endeavors. And I'm really excited to be here and to be talking about this topic today.
Great introduction. We recently were together in Orlando, so we're a little extra giddy to reconnect on this virtual screen. So I thought it would be a good idea to start off the discussion with really a definition. I want to clarify what developmental disabilities are. Sometimes in our field, we go right into our chatter and kind of assume that people understand. So I'm going to just use a CDC definition I'll share. Developmental disabilities are a group of conditions due to an impairment in physical, learning, language, or behavior areas. These conditions began during the developmental period, may impact day-to-day functioning, and usually last throughout a person's lifetime. With that in mind, as we start to answer the question, when you think about the answer to this question, and this goes, of course, I'm going to ask our panelists here, but this goes for any of you watching, please share your thoughts on this in the comments as well. So considering as public health, we're always, filtering things through this population perspective and often, through this health equity lens. But the question I have for you all is, how are you leading and engaging in health equity and developmental disability awareness conversations with the communities that you serve? And I'd like to start off with asking Dr. Gordon to share her thoughts, a response on that question.
Sure, I'll give some background. So the CDC, World Health Organization, and Healthy People 2030 are all in alignment with the efforts being to increase access, increase screening, improve morbidity, and increase data gathering. So in terms of increasing access, we want to maintain health insurance. For those that are privately insured, to maintain that. For those that are publicly insured, to take advantage of the ACA and Medicaid expansion and not have any gaps in insurance. To maintain a medical home so that their care is consistent, cohesive, and without any gaps. In terms of access, it's not just insurance, it's also physical access. So increasing the number of centers that allow for wheelchair access, providing translators for the blind and the deaf. In terms of screenings for children, it's developmental screenings. And I'm still a working pediatrician. So we have child checks where we confirm that children are meeting their milestones. We have screenings that are general for age and that are specific to various conditions such as autism. For adults, it's screening for injury, since injury is a leading cause of disability in adults. And then it's quality of life. So reducing those morbidities that we see in the larger population, like coronary vascular disease, infectious disease, substance abuse, and also ensuring those quality of life issues such as education for children and employment for adults and independent living, as well as ethical reproductive care. Regarding data gathering, my background in public health is in informatics, and it's important that over the years, there's been an effort to standardize the definition of disability for the purposes of allocating resources and data on the population. That affects surveys, that affects how conditions are tracked, and that affects funding. So on my end as a pediatrician, I do a lot of screening, I do a lot of anticipatory guidance and patient education, and I support the medical home, being the person that receives data from specialists, warehousing that data, making sure that patients are getting consistent care, and then as well being the person that orders accessory equipment, whether it's wheelchairs, diapers, what have you. And so that's how I serve in that role. Where I see myself additionally serving in the future is in the informatics and adding to the data gathering and thought leadership and how to do that.
Thank you for that. Really so engaged. So I'm going to ask you a quick follow-up question on that. With health informatics, public health informatics, I'd like for you to first explain what that means, because I think people I've often brought this up on podcast conversations where people assume one thing and not necessarily is where it is. So if you would explain what that means and then go a step further of how you can bridge that with what you've described in your as your role in healthcare.
So informatics is the flow of information, and it can be at the very basic level of coding and the flow of information between hospital systems, making them more compatible. So hospitals within a various location can communicate with each other, states can communicate with each other, interagency communication, and then it's also the governance and flow of information. So how do you communicate with patients and increase health literacy? How do you communicate with patients in the BIPOC community who may have cultural issues regarding translation? So it is the flow of information and can take many forms, from pure coding and design of software, hardware, what have you, cloud systems, to managing just simply how information moves from one system to another.
Excellent. Excellent. Thank you for that. I see you as such a valuable resource. Of course, I'm a huge fan of your work and what you do, but I really do see you as a huge resource and a value add because of all that you've described and what you do on a day-to-day basis now, as well as that lens, that MPH, that Master's of Public Health with that specialization in informatics. You need to be sitting at the table in discussions about plans and programming for sure.
And we look forward to helping. And we like to say that Childbirth handles the flow of information from several angles. So from adopting a worldview for children of faith and a positive outlook with our children's books, to increasing SEO optimization for parents who may be searching on the internet looking for help, and hoping that their keyword searches will direct them to our site, which has resources from the American Academy of Pediatrics, National Association for the Mentally Ill, and our subject matter experts who guest blog. And then hopefully we will develop the consulting end, which influences information that translates into policy.
Excellent. Love that. All right, Ericka, let's hand this over to you. Same question. Let me just restate the question. How are you leading and engaging in health equity and developmental disability awareness conversations with communities that you serve?
Wow, thank you so much for the question. Before I even start, amazing work that you're doing, Dr. Gordon. I really do love everything that you mentioned and discussed. because it is so important, right? So it's very interesting because often people don't even think about developmental disabilities and how they play a role in our society and when it comes to access, when it comes to health equity. Previously, I used to work with our state, and I was a health equity liaison for our children who were with hearing loss. And so with that program or had developmental disabilities, I was really passionate about ensuring that they received the resources or the data was collected and gathered in such a way so that we're able to make, necessary changes as far as accesses and concern is across the state, and even was a part of, ensuring that systems made sense and we collected what was necessary so that our state funds and the work that was done really was beneficial to the state. And now what I've been able to do, even in my business, is as I've worked with different faith-based organizations and churches and even with some nonprofits, is bringing thought leaders and people to the space, those who are professionals in the area of, autism spectrum disorder, or those who have expertise in different areas, bringing them to those conversations. I've helped facilitate trainings with those who may serve like in a nursery or their youth ministry, and they see children, that have different developmental disabilities, but they're wanting to ensure that their workers and their servers and their volunteers are equipped to be able to work with the kids that come to the church, and that parents they know that their children are in a safe space. So they're free to go worship. They're free to, enjoy the service and not have to worry about, is my child being cared for? Is my child receiving the support that they need? Is there someone there that can care for them? So being able to facilitate trainings like that is also a passion project because we do have so many more, and you can speak to it more being a pediatrician, but we see a lot more diagnoses these days, and we see the request and the need in the community and in faith-based organizations. I was in a mom group, and I'm not a parent, but I saw one time how someone asked, hey, is there a church locally that takes care of kids that may have autism? Because they're thinking like, I want to be in these spaces, but I want my child to be safe too. So, people were able to list some of the churches, and I was like, oh, I've worked with them. Like, okay, I know we've been trained. I know that they've done the work to make sure that they're equipped. So that's really the work that I get to do and I'm passionate about, is making sure that everyone who has an opportunity to meet these amazing and bright individuals, whether they're children, whether they're adults, they are equipped to be able to care for them. They're equipped to be able to have conversations with them and not, stigmatize them anymore than society already does. So being able to do that work is just amazing. And then also in different areas, I'm able to, bring information back. So depending on if there's like a survey being done, people will ask, like, is this good? They'll ask for input with your background, working in community engagement, they're asking for your input. How does this work? Do you think it should be translated? And many times we think, oh yeah, translated to Spanish, I'm in Florida, or translated to Haitian Creole, if you're depending on the different areas. But just being able to bring a lens like, oh, well, is it in sign language? Is it in Braille? Like there's more than just like the languages that are spoken, but ensuring that everybody has an opportunity to receive the education, because just because they may, persons may have developmental disabilities doesn't mean that they shouldn't have the opportunity to live long, healthy lives like everyone else. Like we want everybody to be healthy. We want everyone to live a whole life. So just bringing that awareness to the different communities that I'm a part of is really passionate for me. So that's kind of how I'm helping to lead those conversations.
Ericka is right there at the ground level. Her work is so important for several reasons. One, addressing the workforce shortage. We need trained personnel, and addressing, you mentioned the stigma and the isolation. People want to be in a safe space. And so that's both on the clinical end, taking care of their actual medical condition, and then as a member of the community and having those community resources. And Ericka is building those community resources, which is so important. We want people to find a home, a church home, a medical home, legal home. So we want people to have their civil protections in the very general sense of being treated fairly, but we want people to have a full life. And so public health touches on all of those areas and adds to the clinical, simple health maintenance that we try to do for people who are in need. And public health fills in those other gaps. And so there's another aspect that we haven't touched on, and that's emergency preparedness. We saw with Katrina and we saw with the COVID pandemic that the conversations haven't been had before. And so there's been some attention given to BIPOC, but developmental and other disabilities are now getting some attention as their own unique population that need support and institutional things in place in times of peace and in times of emergence, in times of health, when things are stable, and also in times of crisis or worsening condition. So that would be what I would add, that public health is so vast. And then there's a lot of money in this, $400 billion devoted to developmental disabilities and addressing the issues. So there's room and space for us all to impact. And 80% of that money is government or publicly subsidized. So there's room to find a creative space to make that impact.
Thank you for adding that. And you're right. There's so many areas we have not touched, but I'm really resisting going down the rabbit trail to talk more about the emergency preparedness. But let's just, maybe that could be a future topic that we can, tuck this into. But I absolutely agree with what you said. Thank you so much for adding, Dr. Gordon. What about you, Ericka? What are your final thoughts and anything you want to add to, and as we start to wrap this up?
Yes, so I would also add, in addition to the work that we are able to do in our communities, how important it is and how it plays a special place in my life as well. I have family members with developmental disabilities, close friends, and I get to be able to be that voice, be that advocate, and coming from knowing what resources are available and realizing that a lot of people do not know and are not aware of these funds that Dr. Gordon just mentioned that are out there. And so I really think it's important that we, continue to normalize the conversations around health overall and not try to keep everything siloed. I know it's, common to keep things private, especially because you want to protect, but a lot of times it's because you don't know, and there's misinformation and just not knowing and ignorance to what's available. So really trying to intentionally go out and share the information and letting people know the resources that are available, and then going back to those decision makers who are able to make decisions so that they can positively impact our families and our communities is essential. So I would also just bring in that piece of advocacy, especially as more parents are becoming more knowledgeable, and it's not as taboo to, oh, my child has this disorder or my child has this disability. They're having those conversations and then meeting and talking with other parents and realizing that there are more commonalities than there are not, especially in this realm for families, and just the thought process and just developing spaces and circles and safety nets for these families is just so important. So I think that's also just an important piece to add, the community aspect. And even though, I may be able to do a certain amount, those who are in or living in it, they still have the ability to do even more, especially advocate and ensure that their family members are receiving the care that they need. I'm really passionate about empowering people to know what they have access to and making sure that they're equipped to be able to go out and then do the work that they needs to be done.
Well said. Thank you so much. Thank you both. This has been such an incredible conversation. I think we hit right out the gate. It was like, boom, this was like fire right in each corner. Thank you so much. Those that are watching, you've gotten to this point, I know you're probably thinking and have ideas and maybe taking some notes and things you could do. I encourage you to connect with all three of us. If you are not, if we're not already connected, connect with us. Send us a direct message. Let us know what you liked, your comments, your thoughts, ideas. I'm going to really be like I normally am. If you listen to my podcast episodes, I'm like the ultimate cheerleader. But your organization on this top level of trying to bring together this, if you need the expertise of someone who has, the clinical healthcare perspective, especially when we're talking about children, as well as that informatics, that health informatics and that public health expertise, Dr. Gordon is the person that you need to be reaching out to just have that conversation and see how she may be a value add to whatever project you're putting in place. And then as well, with Ericka, if at the community level, especially when we're talking about faith-based connections and those partnerships to serve communities on the ground, events, interaction, engagement, really being person to person interacting, Ericka is absolutely the person to be connecting with. So connect with both of them and chat and see which one can help serve you best. That's going to be my share, my takeaway. And then as for me, I just ask you to follow and continue to support us on these Public Health Roundtable discussions. Thank you again, both for being here live, and thank you for all of you who watched with us live as well as the replay. All right, that is going to wrap it up. You all have a great day, and we'll see you next month on the Roundtable.